not tell me to calm down.
Okay, here with us now is Dr. Anahita Dua, who's a surgeon in Massachusetts General Hospital. Welcome, doctor. Well, you knew vaccines. It's the first time he's been up to testify on Capitol Hill. We're going to come up, even though, you know, we were led to believe this was going to be about the budget cuts at HHS and all of that, but your general impressions of some of what we just heard and the testimony from Secretary Kennedy.
Well, I think it's just another time that we're seeing him to be completely confused. You know, unfortunately, repeatedly, we've seen this man come forward, say things that he stands by, and then backtrack on them, which in and of themselves are problems, but really is completely undermining trust. And the type of contention that we now see, the circus, really, that we're now seeing, is just a product of all that behavior over the last year. At this point, we have no idea what to believe. I think he's trying to completely re-steer the conversation away from vaccines, claiming now that he didn't say the things that he said before. But the trust is eroded. And now what we're seeing is, unfortunately, America nowhere near healthy again. And like you saw on those charts, multiple spikes of diseases that we have already eradicated coming back and ravishing our country. Measles,
what would you say about that? You know, his point, oh, it's worse in Mexico, I think is what he said today. But the idea of these measles cases, most in California in 7 years, and there have been other stats like that. What would you say about the role government has or has not played in all of that?
I hold the government fully responsible for that because of that erosion of trust. Basically, we had eradicated measles, essentially, in the United States. We would have met that criteria by January, actually, of this year. But unfortunately, by making a question around the measles vaccine and vaccines in general, a number of parents just simply didn't know what to do. And as a result, their children did not get vaccinated. And measles is one of the most contagious types of diseases that you can have. And so if a patient is in a room with other patients that are not vaccinated, unfortunately, it's going to spread like wildfire. And that's exactly what we've seen. I actually think that RFK himself is surprised because it's really easy to go on a podcast or go on TV and just say whatever you want. But now he's faced with actually leading the country as a health expert. And he is actually learning in real time what happens when you say these types of things.
What about just the practical side of it? Dealing with a department that's going to have fewer funds, said the president wants to cut HHS's budget by 12%.
Well, that's, of course, going to have a major ripple effect because HHS really is all about public health and preventative effects. And what's confusing about that is, on the one hand, talking about cutting the 12%, as you mentioned. On the other hand, a whole conversation around preventative health and trying to push, you know, these food agendas and other things that would really align with actually, if anything, increasing the budget, because you're going to need to reach communities that you otherwise currently do not reach. And so, again, this message is very confusing. And then the most important thing about it is a budget is on paper. Ultimately, you have to understand what the unintended consequences would be of cutting the budget. We are already in dire straits, so cutting it by 12%, frankly, will mean that we're going to see a big ripple effect again in another year of even a worse state than we're in currently.
You know, I know you and many others in traditional medicine are not fans of the way the secretary goes about things or many of his ideas or policy proposals, but you mentioned food, and some of these suggestions on, you know, what we eat and got to eat, quote unquote, real food, as he talks about all the time. You don't think some of that is worthwhile?
Well, you know, the thing about it is you could go home and talk to your mother-in-law and say, hey, what should we do to make America healthy? And she'll say, eat better food. We don't need this guy up there telling us that. What we need is, how are you going to do it, man? That's the question. And that's what he kind of refuses to get into, the execution. Anyone can say it's a great idea to have world peace. You know, every single woman who's been on stage as Miss America has said that. But again, it's the execution that matters. Right. So I don't need, you know, quotes from Miss America. I need quotes from the HHS secretary telling me how to make America healthy again. And I'll tell you what, it's not like this.
All right, doctor, thank you. Dr. Dua with us from Massachusetts. Now coming up, an important warning from a top energy